Prostate cancer is a significant health concern for men. It is a disease that primarily affects older men, but younger men are not immune. The risk of developing prostate cancer increases with age, and it is essential to be aware of the symptoms and risk factors. It affects the prostate gland, a small gland located below the bladder. This gland plays a crucial role in the male reproductive system by producing seminal fluid, which nourishes and transports sperm. This gland is responsible for producing seminal fluid. When cancer develops in the prostate, it can grow slowly and remain confined to the gland, or it can be aggressive and spread quickly to other parts of the body. Prostate cancer is the second most common cancer in men worldwide. It is surpassed only by skin cancer. The statistics are staggering, and the impact on men's health is profound. In the United States alone, it's projected that nearly 300,000 men will be diagnosed in 2024. This number highlights the importance of awareness and regular screening. Sadly, an estimated 35,000 men will lose their battle with this disease this year. This loss is felt deeply by families and communities, emphasizing the need for continued research and support. While these numbers are alarming, there is hope. Advances in medical research and treatment options have significantly improved the prognosis for many men diagnosed with prostate cancer. The 5-year survival rate for prostate cancer is high, around 97.5%. This statistic is encouraging and underscores the importance of early detection and treatment. This means that the majority of men diagnosed with prostate cancer will live at least 5 years after their diagnosis. Many will live much longer, enjoying quality time with their families and friends. Early detection is key to successful treatment and long-term survival. Regular screenings such as PSA tests and digital rectal exams can help detect prostate cancer in its early stages when it is most treatable. Understanding the risk factors, screening methods, and treatment options is crucial for men of all ages. By staying informed and proactive, men can take charge of their health and improve their chances of a positive outcome. Prostate cancer often develops slowly and may not cause noticeable symptoms in its early stages. This is why it's often called a silent threat. While the exact causes are unknown, several risk factors increase a man's likelihood of developing prostate cancer. Age is a primary factor, with the risk significantly increasing after age 50. Family history plays a role. Having a father or brother with prostate cancer doubles a man's risk. Ethnicity is another factor. African American men have a higher incidence rate and are more likely to develop aggressive forms of the disease. Genetic predisposition also contributes, particularly mutations in genes like BRCA1/2 and Lynch syndrome. Early detection is critical for successful prostate cancer treatment. The sooner the cancer is found, the better the chances of managing it effectively and improving the patient's quality of life. The most common screening tool is the PSA test, a simple blood test that measures prostate-specific antigen levels. This test is often the first step in identifying potential issues with the prostate. Elevated PSA levels can indicate the presence of prostate cancer, but it's important to note that not all elevated PSA levels mean cancer. Various factors can influence PSA levels, and further testing is usually required to confirm a diagnosis. Other conditions like benign prostatic hyperplasia or BPH or prostatitis can also elevate PSA. These conditions are non-cancerous but can cause similar symptoms and require different treatments. False positives and the potential for overdiagnosis are concerns with PSA screening. Overdiagnosis can lead to unnecessary treatments that may have significant side effects. Shared decision-making between doctor and patient is crucial, particularly for men aged 55 to 69. This process involves discussing the risks and benefits of screening and considering the patient's values and preferences. However, earlier screening discussions are recommended for those at higher risk, like African American men starting at 45 and those with a strong family history starting at 40. These groups are more likely to develop prostate cancer at a younger age and may benefit from earlier intervention. Treatment for prostate cancer varies depending on factors like the stage of the cancer, the patient's overall health, and individual preferences. The good news is that we have a range of effective treatment options available. For localized prostate cancer, where the cancer is confined to the prostate gland, options include surgery, radiation therapy, and active surveillance. Surgery typically involves removing the prostate gland, known as a prostatectomy. Radiation therapy uses high-energy rays to destroy cancer cells. Active surveillance involves closely monitoring the cancer's progression and intervening with treatment if necessary. For more advanced prostate cancer, treatment options may include hormone therapy, chemotherapy, and newer therapies like immunotherapy and targeted therapy. The field of prostate cancer treatment is constantly evolving, offering new hope for patients. Recent years have witnessed remarkable advancements, particularly in targeted therapies and immunotherapy. Targeted therapy focuses on attacking specific molecules or pathways crucial for cancer cell growth and survival. PARP inhibitors like olaparib and rucaparib have shown promise in treating prostate cancers with specific DNA repair defects. Immunotherapy, on the other hand, harnesses the body's own immune system to fight cancer. Checkpoint inhibitors like pembrolizumab have demonstrated efficacy in some patients with advanced prostate cancer. Another exciting development is Sipuleucel-T, a personalized immunotherapy that trains the immune system to target prostate cancer cells. Section 6. Key clinical trials. Shaping treatment guidelines. Clinical trials are essential for evaluating new treatments and refining existing ones. Several recent trials have significantly impacted prostate cancer treatment guidelines. The ARASENS trial demonstrated the benefit of adding the drug darolutamide to standard hormone therapy for men with high-risk, metastatic, hormone-sensitive prostate cancer. The PEACE-1 trial showed that adding abiraterone acetate, another hormone therapy drug, to standard treatment improves survival in men with newly diagnosed, metastatic, hormone-sensitive prostate cancer. These trials, along with others like Enzamet and Stampede, are helping oncologists tailor treatment strategies based on the specific characteristics of a patient's cancer, leading to more personalized and effective care. Section 7. Metastasis-directed therapy, targeting spread. Metastasis, the spread of cancer cells from the original tumor site to other parts of the body, is a major challenge in cancer treatment. Metastasis-directed therapy, or MDT, focuses on targeting and eliminating these distant cancer cells. Stereotactic body radiotherapy, or SBRT, a highly precise form of radiation therapy, is emerging as a viable MDT option for men with a limited number of metastatic sites. Clinical trials like SaberComet, STOMP, Oriole, and Extend are evaluating the effectiveness of SBRT in controlling metastatic prostate cancer. These studies are providing valuable insights into the optimal use of MDT and its potential to improve outcomes for patients with advanced disease. Section 8. Exploring new frontiers, ongoing research and the future. The field of prostate cancer research is dynamic, with scientists tirelessly working to develop new and innovative treatments. These dedicated researchers are constantly pushing the boundaries of what we know and understand about this complex disease. Their work is not just confined to laboratories, it extends to outdoor settings where they can study the disease in more natural environments. Current research is exploring various avenues, including the development of novel targeted therapies and immunotherapies. These therapies aim to specifically target cancer cells while sparing healthy ones, thereby reducing side effects and improving patient outcomes. Immunotherapies, in particular, are showing great promise by harnessing the body's own immune system to fight cancer more effectively. Scientists are also investigating the role of the tumor microenvironment, the surrounding cells and tissues that support tumor growth, in prostate cancer progression. By understanding how these elements interact with cancer cells, researchers hope to uncover new ways to disrupt these interactions and slow or stop the progression of the disease. Understanding the complex interplay between cancer cells and their microenvironment could lead to new therapeutic strategies. This knowledge could pave the way for treatments that are more effective and less invasive, offering new hope to patients and their families. Another area of active research is the development of biomarkers, measurable indicators that can predict how a patient's cancer will respond to treatment. These biomarkers could be found in blood, tissue, or other bodily fluids and could provide critical information for tailoring personalized treatment plans. Biomarkers could help personalize treatment plans and improve outcomes. By identifying which treatments are most likely to be effective for individual patients, doctors can make more informed decisions, leading to better results and a higher quality of life for those affected by prostate cancer. Section 9. A call to action, awareness and hope. Prostate cancer is a serious disease, but it's not an automatic death sentence. With early detection, a range of effective treatment options and ongoing research efforts, there is significant hope for the future. Men need to be proactive about their health. Talking to your doctor about risk factors and screening options is crucial. Early detection is key to successful treatment and improved survival rates. By staying informed and engaged in their healthcare, men can make informed decisions and navigate the challenges of prostate cancer with greater confidence and hope.